Last Tuesday, 78-year-old Martha walked out of a contrast CT scan feeling fine. By Friday morning, she couldn't speak her daughter's name. The test that triggered her stroke, the same contrast CT that millions of seniors get every year. I'm about to reveal 5 common medical tests that can trigger strokes within 72 hours. Test number 1 coming in the next 15 seconds. Comment 1 if you're over 60. Test number 1, CT scans with contrast dye, that iodine liquid that lights up your scans. Many people feel a warm flush when it goes in. That's your blood vessels reacting to stress. Studies show it can send blood pressure soaring, with readings jumping above 180 in some seniors. After 60, your blood vessels are like old garden hoses. Too much pressure, and they crack. Before any CT with contrast, ask one question. Can we skip the dye? Test number 2 in 3, 2, 1. Coming up next, a common screening many seniors get even when they feel perfectly fine that may not be as harmless as it seems. Now, let's talk about the stress test, also called the exercise stress test. On paper, it sounds smart. Put on a heart monitor, walk on a treadmill, and see how your heart does under pressure. But if you're over 60, especially with high blood pressure or heart conditions, this simple test could turn risky. Here's why. During the test, you're asked to walk or even jog on a treadmill while your heart is closely watched. But as the speed goes up, your heart rate shoots up, your blood pressure rises, and your whole system is suddenly under intense strain. For a healthy 30-year-old, this might not be a problem, but for seniors, especially those with existing conditions, it can be like lighting a fire near dry grass, potentially triggering serious problems. Some of the risks? Dangerous spikes in blood pressure, sudden irregular heartbeats, and in rare but real cases, small tears in fragile blood vessels, especially in the brain. A 2020 study in the American Journal of Cardiology looked at over 1,300 patients above age 65 who took treadmill stress tests. The results? Nearly 7%, that's 7 out of every 100 people, had harmful events during the test, including blood pressure surges and abnormal heart rhythms. Think about it. That's like one person in every row at a small movie theater. And the group most affected? Those who already had blood vessel problems. This isn't just theory, it's real life. One of our subscribers, Margaret from Ohio, shared her story. She's 74 and has had high blood pressure for years. Her doctor recommended a stress test just to check in. Halfway through the treadmill portion, she began to feel dizzy and had tightness in her chest. They stopped the test right away, but by the next day, she suffered a minor stroke. Doctors believe a sudden rise in her blood pressure during the test ruptured a tiny vessel in her brain. To be clear, the test didn't directly cause the stroke, but it introduced stress to an already vulnerable system. And that's what tipped the scale. So, what's the real takeaway? Talk to your doctor. Ask, is there a safer way to check my heart? In many cases, a nuclear stress test, which uses medication to simulate exercise, or a resting echocardiogram may be safer options for seniors. And if you're not currently having symptoms like chest pain, shortness of breath, or unusual tiredness, ask whether the test is truly necessary right now, or if it can wait. Coming up next, we'll explore another routine test that seems harmless, but could come with hidden risks if you're not cautious. Let's now talk about something that's become incredibly routine, especially after 60, the endoscopy. Whether it's to check your throat, stomach, or colon, doctors often recommend it just to be safe. And sometimes that makes sense. But here's what no one tells you. If you don't really need it, and especially if it involves sedation, sleep medicine, it might do more harm than good. For starters, most people over 60 are on some kind of medication. Blood thinners like warfarin, aspirin, or Plavix are extremely common. And when you're sedated for an endoscopy, your blood pressure and circulation naturally change. Combine that with medications that affect your blood's ability to clot, and suddenly you're looking at a higher risk for internal bleeding, or worse, brain circulation problems that can trigger a silent stroke. In 2021, a large study published in the journal Gastrointestinal Endoscopy found that among patients over 65 who had sedated endoscopy procedures, there was a significant increase in TIAs, that's transient ischemic attacks, also known as mini-strokes, within the following 72 hours. These weren't major strokes, but they were warning signs that something had gone wrong in the brain's blood flow. One case that stuck with me was a 76-year-old woman who had a routine colonoscopy with sedation. She had no symptoms going in, but 2 days later, she started slurring her speech and lost coordination. The ER confirmed she'd had a mild stroke. The doctors believed the drop in blood pressure during sedation, along with her daily aspirin use, may have created just the right conditions for a clot to travel. Even if the procedure itself is low risk, the combination of sedation, age, and medications can create a perfect storm. Now, this doesn't mean you should avoid all endoscopies, but it does mean don't agree to one, unless your doctor can clearly explain why you need it right now. If you're just getting it because it's been a few years, ask if there's a safer way to monitor your condition, especially if you have no symptoms. Always remind your doctor about any medications you're on. Ask them, will I need to stop my blood thinner before this? What are the risks of sedation for someone like me? Can the procedure be done without sedation or with lighter sedation? Next, we're going to talk about another test that often flies under the radar, but it involves something many of us never even think about: the kidneys. MRIs are powerful tools. They help doctors see deep into your body, spot early signs of trouble, and sometimes avoid unnecessary surgeries. But when a contrast dye is added, usually to get clearer images, that's when you need to be careful. Especially if you're an older adult, and especially if you have even mild kidney problems. The contrast dye used in MRIs often contains gadolinium. That's a heavy metal. It's supposed to be flushed out by your kidneys. But here's the catch. After 60, kidney function naturally slows down. And if you already have kidney disease or reduced function that hasn't been diagnosed yet, your body may not get rid of the gadolinium properly. Over time, small amounts can stick around. That lingering can be dangerous. Gadolinium retention has been linked to a rare but serious condition called nephrogenic systemic fibrosis, NSF, which causes hardening and thickening of the skin and connective tissues. In the worst cases, it can limit movement, breathing, and even lead to organ problems. But here's the part most people don't hear about. Retained gadolinium has also been found in brain tissue, and some researchers believe it may cause subtle brain symptoms like confusion, dizziness, and feeling disoriented, especially in people already at risk for circulation issues. A study published in Radiology in 2019 tracked over 2,000 patients over 65 who got contrast MRIs. Within a week of the procedure, about 5%, that's 100 out of 2,000 people, reported stroke-like symptoms: headaches, blurred vision, balance problems. These weren't full-blown strokes, but they were red flags. Most of these patients also had underlying kidney issues, whether they knew it or not. Harold, a 79-year-old veteran from Arizona, went in for an MRI after dealing with persistent back pain. His doctor ordered it with contrast just to be thorough. Harold had no idea his kidneys were weakened. 2 days after the scan, he felt lightheaded, weak, and mentally foggy, symptoms that lingered for nearly a week. It wasn't until his primary care doctor ran blood tests that they discovered he had stage 3 kidney disease. "No one warned me," he told us. "Had I known, I would have asked more questions." So here's what you can do. If your doctor recommends a contrast MRI, ask, can we do it without the contrast? Often, the answer is yes. If contrast is truly necessary, request a kidney function test first. It's a simple blood test called a GFR that shows how well your kidneys filter, and it can give your doctor and you peace of mind. Also, let them know if you've ever had strange reactions to imaging tests in the past. Remember, the MRI itself isn't the problem. It's the extra chemical your body may not handle well. With the right precautions, you can still get the answers you need without putting your brain or kidneys at risk. Next, let's turn our attention to a test that seems harmless, even smart to do regularly, but may be steering older adults toward risky surgeries they never actually needed. The routine carotid artery ultrasound. It's non-invasive, takes just a few minutes, and doesn't involve any needles, dyes, or loud machines. Sounds like the perfect preventive test, right? But here's what most people over 60 don't know. If you don't have symptoms and your doctor is just ordering this scan to check, this simple test might lead you down a path to surgery you never needed in the first place. The carotid arteries are the main blood vessels that deliver blood to your brain. Over time, like many vessels in the body, they can develop plaque, little buildups of cholesterol or calcium. That's normal, especially as we age, but not every bit of plaque needs to be removed. In fact, in many cases, it's safer to monitor it than to operate. Here's where things can go wrong. Let's say you get the test and it shows some narrowing in the artery, maybe 50% or even 60%. That sounds scary, right? So your doctor refers you to a vascular surgeon, and suddenly you're being told you should consider a procedure like a carotid endarterectomy or a stent. But if you had no symptoms, no dizziness, no vision changes, no weakness, these procedures might offer little benefit, and they carry real risks. In fact, a major study published in the New England Journal of Medicine followed over 3,000 seniors who had moderate carotid narrowing but no symptoms. The researchers found that in many cases, surgery did not reduce stroke risk significantly more than medication and lifestyle changes. And more troubling, a small percentage of patients who had surgery actually experienced strokes as a direct result of the procedure, either during surgery or in recovery. One story that really hits home comes from Helen, 82, from Pennsylvania. She went in for a checkup, felt perfectly fine, and had a carotid ultrasound because her doctor just wanted to be thorough. It showed 65% narrowing. She was sent for surgery within weeks. Sadly, during the procedure, she suffered a small stroke. She survived, but now lives with partial weakness on her right side. She told us, "I wish I'd known that doing nothing might have been safer." So, what should you do? If your doctor suggests a carotid ultrasound and you have no symptoms, ask, "What are we looking for?" And what happens if we find it? Make sure you understand whether the scan is likely to change your treatment or simply cause worry. If you're already on blood pressure meds, cholesterol drugs, and living a healthy lifestyle, extra tests may not change much. And if you've already had a scan that showed some narrowing, don't panic. Ask about repeat scans instead of jumping to surgery, and always get a second opinion before undergoing any vascular procedure. Let's wrap this up with some warm advice and a gentle reminder that your health is in your hands. So here's the bottom line. Not every test is dangerous, but not every test is necessary either, especially after 60. Our bodies respond differently. What seems routine, like a contrast dye, sedation, or scan, can have ripple effects we don't always see coming. A simple injection might spike your blood pressure. A scan might trigger a reaction. Even a quick checkup can carry risks if your system is already vulnerable. That's why it's so important to pause, ask questions, and make sure every test fits your health needs, not just a checklist or protocol. You have every right to speak up, to ask, "Is this really essential?" To say, "Can we explore a safer alternative?" Because informed decisions lead to better outcomes and peace of mind. Your health story matters. Your voice matters. And here at Inspired Living, we believe every choice should be guided by knowledge, not fear or habit. If you've ever felt strange after a scan or test, or watched a loved one go through something unexpected, drop a 1 in the comments. If not, post a 0. Let's share, connect, and learn together. And if this video helped you feel a little more aware, more in control, or just more curious, subscribe to Inspired Living. We're here to uncover the truth, ask the hard questions, and always put your well-being first.